Hi, everyone. It's Dr. Haddad, Chief Staff at the hospital here in Sarnia. It gives me great pleasure tonight to welcome our own Sarnia native, Dr. Suman Chakrabarti, who's an infectious disease specialist practicing in Mississauga. We've had him here before many times. Thank you for joining us tonight. And we also have Dr. Laura Allen, who's a practicing obstetrician gynecologist in Sarnia as well. And the topic tonight will be mostly focused on issues pertaining to COVID-19 vaccination vis-a-vis fertility and pregnancy questions. As you know, we've been through multiple waves of this pandemic. Hopefully, we're in the latter parts of it, but nevertheless, we have entered the fourth wave in Ontario. It seems to be a bit worse on the west end of the country, but nevertheless, we'll see how the fall and winter goes. Vaccination has increased quite a bit since the last wave we had, the horrible third wave that we've all experienced. We're up to 81% fully vaccinated adolescents and adults, 12 plus years of age. We have noticed, though, that the uptake of vaccination isn't as high in the younger women age group who are contemplating being pregnant. It's about 50% versus 80% in the general population. And many of the questions we're getting asked now is basically, it's mostly a bit of hesitation and anxiety about this new quote unquote vaccine, even though vaccination during pregnancy is not a new thing. As we all know, pregnant women do get various vaccines, especially if they're not live viruses. Nevertheless, we have with us two specialists in this field. One is OB/GYN and one infectious disease. And the session will be dedicated mostly for public questions and answers, so you can pick their brains. So Dr. Allen, what kind of questions are you getting from your own clients or expecting moms about who are contemplating either getting pregnant or actually pregnant in the various stages of pregnancy?
Thanks, Dr. Haddad, for having me here tonight. It's a good question. People are always asking about whether or not the vaccine's safe, whether or not the risks of the vaccine are equivalent or more than the risks of COVID, which is not. When to get the vaccine, whether they should get it in a certain trimester or wait till after pregnancy is completed, if they should delay trying to have children after the vaccine. So these are common questions that we've all been getting. I think one of the things that we struggled with early in the epidemic is we didn't know very much about COVID in terms of what it was and how it was transmitted. When the vaccines were first researched, women who were pregnant were excluded from those trials, as is often the case from early medication and vaccine trials. Pregnant women are always excluded. When evidence came out that women who were inadvertently or unknowingly pregnant were vaccinated and had fairly equivalent outcomes, the uptake increased. And just looking at the stats today, 160,000 plus women in the United States have been pregnant and vaccinated, and their outcomes compared to women who are unvaccinated are equivalent. Side effects from the vaccine are equivalent, and it seems to be protective in pregnancy. So we're now endorsing it. Health Canada, our organization, the SOGC, the American Obstetrics Organization, ACOG, and the CDC are now endorsing it in women who are contemplating pregnancy, pregnant already, regardless of the trimester, and postpartum if they haven't received it already, regardless of breastfeeding status, as breastfeeding doesn't affect it at all. So I've been endorsing it, but ultimately it's a personal decision on the part of the patient.
Any comments about the protective effect on the unborn child or shortly after birth, given the development of antibodies in the mom?
Yeah, it's a good question. So you mentioned earlier that we recommend vaccination in pregnancy, even before COVID. The two most common vaccines we recommend are pertussis immunization and the flu shot in pregnancy. And one of the reasons why is obviously to protect mom, especially for flu. But the other reason is to have the baby to have some antibodies and passive protection for the first few months of life. With the COVID vaccine, because you did ask me this a little while ago, they have shown that babies do have evidence of antibodies after birth, antibodies in the cord blood that's been tested. We think those antibodies, we're fairly certain those antibodies are mums, and they're crossing the placenta and protecting babies, as opposed to the vaccine itself affecting the babies or stimulating an immune response in the babies. So it doesn't give lasting protection, but it does give transient protection potentially in the first few months of life, which is obviously beneficial, especially during the fourth wave of COVID.
And my understanding, I'm not an obstetrician, but my understanding is that, especially in the first trimester, many of our staff and patients and people I speak with are worried mostly about the first trimester, given that the structural development happens there from an embryological standpoint. And even without COVID, before vaccination, there's always a sort of usually about 10 to 20% risk or so of spontaneous fetal loss, right? And my understanding is in the most latest studies being published, large cohorts of tens of thousands of pregnant women, that there hasn't been any increase or a signal of increase in spontaneous fetal loss with vaccination compared to pregnant women without vaccination. Is that what
that's right. So the first trimester is defined as the first 0 to 12 weeks. It is the most important step in terms of the initial development of organs. For most of your organs, they are developed by the end of 14 weeks, and then the rest of pregnancy is about, growing and maturing. So we know that with certain medications and drugs, we try to avoid in the first trimester. Vaccines are not one of them. One of the reasons why we time vaccines in pregnancy, sometimes for certain trimesters, like the pertussis vaccine, is just to have a higher antibody response near term. So we're trying to time it to protect baby with antibodies, not to protect them from the effects of the vaccine. So the other thing that you mentioned was the risk of spontaneous miscarriage. It does vary with age. I usually quote around anywhere between a 10 to 20% risk of miscarriage. And the majority of the time, we don't know why it happens. When women have a miscarriage, a lot of the time they do look back at the last few weeks. What have they eaten? What have they taken? What could have possibly caused this? Trying to find a reason why. And so if you have a vaccination or something that's kind of out of the ordinary, it's easy to sort of pin it on something like that. But large studies have shown that the rate of miscarriage in unvaccinated women versus vaccinated women is the same. So we're encouraging women to get it in the first trimester.
That was actually one of the first questions we got via Facebook is, does the vaccine increase chance of miscarriage or fetal malformation? I think you answered that question. Thank you. Dr. Chakrabarty, I think you have a unique perspective, given that the GTA was the epicenter of our third wave. We had, speaking with some of my colleagues at various hospitals in Toronto, in the Toronto area, they unfortunately had many pregnant women who got infected with COVID-19 itself, and had many of them had fairly horrible outcomes. What's your experience there in the GTA, and can you comment on that? Because everything in life, vaccine or no vaccine or infection, is about risk and benefit, right?
Yeah, I think that is very true. Being in Mississauga, we were one of the hardest hit cities in the entire country, to be honest with you. And it was a harrowing third wave. We saw that wave, not just younger people, but I saw a lot of pregnant women get ill. Thankfully, for the most part, they did well. But clearly, being in hospital was something that was quite a stress on the system. So we know that this risk is quite real. I think that has translated. Most of the people that are concerned about vaccine, you want the vaccine. I know it, but it's the fear that comes along with the effects of the vaccine on you, on the baby, on the pregnancy. And one thing I do want to mention is that after the third wave, there's quite a bit of discussion that I've had with multiple, especially young women at my hospital, who are worried about exactly these things you mentioned: fertility, spontaneous miscarriage, et cetera, et cetera. And I think the first thing I always tell everybody is these concerns are completely normal to have. Any person who's thinking about it, I get it. And I can actually disclose this now. I have permission of my wife. Is we had this exact talk because we were planning for kids. She's now 28 weeks pregnant. And, so it's good. And we were healthcare workers. So we were vaccinated very early on. And she got vaccinated just to say around conception time. That's around when it happened. Everything's fine. But the reason I bring this up is that I understand that trepidation. And I think part of having conversations with people is meeting them where they are, answering the questions, reassurance. And I don't want to say convinced, I've persuaded and had many women, I've had talked to at least 50 who have gone on to get the vaccine. So, with what Dr. Allen says, completely agree with her about the endorsing of this vaccine. It's good, it's safe. And I think ultimately, given what we know COVID can do, we saw especially in the third wave, that it's something that is very beneficial.
Thank you. We have a question. It says, after I got my first dose, I was given a sheet that said to avoid pregnancy for 28 days. Is this still true?
I actually think that's a great question. So I was talking to another one of the gynecologists in the community, and she had actually seen that sign at a vaccination center at public health and sent me a picture of it. And so I talked to our public health the other day, and all those signs have been changed. So I think early on in the pandemic, when we were vaccinating, we didn't have any guidelines. So they did put that up saying, you know, don't get pregnant for 28 days. Now there's no evidence to say that pregnancy needs to be avoided, but it was something that was out there in the community. That's a good question.
Yeah, I think my understanding is early on, as the vaccines were being rolled out, they knew that 10-20% of there's miscarriages in the first trimester, and they didn't want to mix it with the potential the new vaccine coming in and people blaming it. So I think they wanted to avoid the first trimester, but you know, we have more and more data showing that it doesn't really make any difference. Thank you for that. I have another question from our Facebook audience. Any data on passing antibody/cell-mediated immunity to baby by breastfeeding from a vaccinated or a previously infected mom? Maybe Dr. Chakrabarty, if you want to tackle that one.
Dr. Allen's the expert, but the answer is yes. There does look to be, you know, Dr. Allen was mentioning it just previously that there's some evidence that's showing that there is presence of antibodies from mom in cord blood, which can then at least provide temporary protection for the baby. In terms of cell-mediated immunity, I'm not actually aware of that. I don't know, Dr. Allen, do you know in the baby, this to me looks like it's all, the term passive immunity, by the way, means that the antibodies that mom has made, the baby is using and it's protecting, but the baby is not mounting its own response. And generally that's the case with infections where the baby is borrowing mom's antibodies. I haven't heard anything about the baby producing its own, unless Dr. Allen, if you can elaborate.
I kind of guess we'd be asked that question. So today I did a little bit of digging. Yeah, so basically it doesn't look like it does. So mRNA, which is what the majority of the vaccines and all pregnant women are getting, only mRNA vaccines, it's out of your system in a couple days. It doesn't seem to cross the placenta. The placenta is a very good filter. And so the antibodies in babies are a specific type of antibody that can cross the placenta. And there's another type of antibody that we all make in the first few weeks after you get an infection that's kind of bulky and can't cross the placenta. So they think because the baby has one type of antibody, but has never been shown to have the other type, that it's not getting it from the vaccine, it's getting it from mom. So that's kind of what the studies are saying. Obviously, you have to have a baby months and months out from birth and then had antibodies and now they're gone, but there's no studies that show that now because it's just still so new.
And to address one of the questions, my own understanding is that these passive antibodies from the mom passing through the baby usually don't last forever, about 3 to 6 months or so. Is that correct? And then they will go away. But that is still a high risk period for a baby if they get COVID because their immune system is still immature. So it's beneficial to have some protection during that period. Isn't it true?
Although to be fair, one of the big reasons that we see people getting very sick from COVID is their own immune system, right? It's being hijacked, if you will. But yeah, but in general, like we haven't seen a big. It's quite interesting how we have not seen a signal for severe disease in kids. You see the occasional one, don't get me wrong, but yeah.
You're right. Yes, I'm getting many questions actually. So. One question is, I'm curious to know how the vaccine is considered completely safe for pregnant women when it is not yet approved for children under 12 years of age. I mean, it's a different age category. Usually women are adults. Suman, you want to?
Yeah, it's a good point. I think that one of the big things, you see these age cutoffs, 12 to whatever, under 12. There's a reason for that with vaccinations. And part of that is because, as you'll often hear pediatricians say, is that kids are just not small adults. They're quite different in terms of the way their immune systems respond, which is part of the reason, for example, childhood vaccines, you have to give 3 doses to get that immune response because the immune system is immature. The other reason is that it's actually something that we haven't been talking about a lot, is that I think everyone right now is waiting on kids getting vaccinated, and the jury is actually out if we even need to do it. And the reason why I say that is that vaccination for an adult makes sense because number one, you're protecting yourself because you have a significant risk, especially if you're over the age of 50, of getting sick and being hospitalized. And the second thing is that you have a significant risk, especially as a younger adult, of passing COVID to other people. And the vaccination helps with that. Once you get to a point where you're under 12, it's not clear that, number one, it's protecting you personally because the kid's risk of severe disease is so low. And kids, yes, absolutely, they can transmit, but the epidemiologically on a broad scale, they don't do it as much to a very significant extent. So it's going to be interesting to see what Health Canada says about that when they get through the evidence and whether we need to vaccinate kids or not, and if we should make it mandatory.
Again, going back to that risk and benefit, where it's the calculus is so wide when someone who's say 75 years old, and it shrinks as we get younger and with less comorbidities, for example, and the risk calculus is sort of a different, basically different equation between 5 and 11. We'll see what Health Canada says about that. I have a question that is that comes up quite a bit, and actually for both adults, but this one pertains to unborn child. Will it change their DNA? Dr. Allen.
No, I guess that's the short answer. So mRNA vaccines, it's complicated, but mRNA vaccines go into the cell, but they never enter the center of the cell called the nucleus. You probably know this better than anybody else, Dr. Chakrabarty, but they don't go into the nucleus. They can't actually go backwards and go into your DNA. They break down within a few days. And all that's basically left is the memory of them being there. So it can't. That's just the long and short of it. And it never will. So I feel, and I don't know if you agree with this, that in the future, we're going to have a lot more vaccines that are going to be mRNA vaccines because it's the fastest, most efficient way to make a vaccine. And maybe one day we'll have vaccines for diseases that we never thought we could vaccinate against. So I feel like this is just the next wave.
I completely agree. And the one way I put it, the analogy that I use is especially with mRNA vaccines. The AstraZeneca actually does have a stage that enters the nucleus, but the big point of it is, though, I think of it like a soggy IKEA instruction manual. You basically can read it once and follow the instructions, and then it just falls apart. It's gone. It's gone within hours. But that's enough for you to be able to produce an immune response by producing the spike proteins that your immune system then is able to make an immune response. But it's not something that is incorporated into your body. It's gone like soggy newsprint.
Yeah, I completely agree with this, having worked with RNAs in my previous life in the lab. So yeah, the genetic code is a DNA. The way it is transcribed and translated into proteins is via the intermediate RNA messages that makes the protein, in this case, spike protein, that tricks our own immune system to think that there's an infection, right? So no, so it does not change the DNA for adults and babies. Next question is will I get sick from the vaccine because I'm pregnant? Is it a higher risk?
That's a good question too. So I looked that one up again today. And they've done big studies, basically the same study where they looked at the 160,000 women, and the side effects are similar. So in pregnancy, your immune system is a little depressed, which is why you get more advanced disease, but your side effects are similar. So fever, which you can take, regular strength Tylenol for. You will have a sore arm, maybe some swollen lymph nodes, feel under the weather for a few days, and then quickly recover. We've been only using mRNA vaccines in pregnancy, not the AstraZeneca. So in this particular talk, it'll only be basically Pfizer and Moderna. They have anecdotally said that you have a little more of a pronounced reaction if you mix vaccines. So if you do Pfizer and Moderna, or the other way around. So I've been advising my pregnant patients, if your first dose was this, then your next dose should be the same thing, but mainly just to minimize side effects. And it's not a pregnancy versus not pregnancy thing. Do you agree, Dr. Chakrabarty?
Absolutely. And one thing that I'll add is that those side effects that you feel are actually your immune system activating. So one interesting thing to also mention is if you've had COVID before, and you take people will often get the worst side effects on the first dose. It's a trend. It's not complete, but if you most people who haven't had COVID before tend to get more side effects on the second dose. Either way, it's just evidence your immune system is turning on and making a response.
The infection is sort of like your first shot. So when you get your actual first dose, like your second shot in a way, isn't it?
Exactly.
I have a question again that pertains to, I would say, adults and kids. Is can I catch COVID-19 from getting the vaccine?
I'll take this one. Yeah. So no. So the one important part about this vaccine is it's not a live vaccine. So there are certain vaccines that are live vaccines, yellow fever, measles, mumps, rubella, and theoretically, if somebody is quite immune suppressed, especially, we often avoid giving these vaccines because even though there's a weakened virus, it can cause potential disease. But this is not the case for the COVID vaccines, especially the ones that we're using in this talk is the mRNA. Pfizer and Moderna. There's no live virus in there. The symptoms you're getting are from your immune system turning on, not from viral infection.
Thank you. A question: as a new mom, postpartum of 2 weeks, who is breastfeeding, is it safe to get the vaccine now?
Yes, go get it. It's a perfect time to do it. If you haven't gotten it already, you can book your appointment online. You can go to a drugstore and get it. I strongly encourage you to do it.
Yeah, the concern here is that I'm quoting the question is, my concerns regarding vaccine being transmitted to my baby through the breast milk.
So good question. So mRNA most likely is broken down in the stomach. So say you got vaccinated right before you breastfed, it's in your system for a day or two potentially. It could be in the breast milk, but the digestive acids in a baby's stomach should inactivate the mRNA. So there'd be no chance the baby could be vaccinated or be exposed by breastfeeding based on all the research done so far. Basically, mRNA is like almost like if you eat something or a meal and your stomach will break it down.
Okay, thank you. I have a question here is, I am a fully vaccinated and 27 weeks pregnant. Am I as safe as an average healthy person who is fully vaccinated, or am I still at more risk due to being pregnant? Suma?
So this one is actually pretty easy. It's interesting to see that there's lots of risk factors for severe COVID. Once you're vaccinated, that actually really evens the playing field. So even somebody who's 80 years old, the risk of hospitalization, severe illness has significantly dropped, about the same. If you are, so the question, if you are a 28-year-old, third trimester pregnant woman compared to a fully vaccinated 50-year-old, the risk is about the same. Where we do see an issue is individuals who are in nursing homes and advanced age. So if it's an 85-year-old in a nursing home, there is some evidence that there is especially going on, waning immunity with against severe disease. But for all other populations, it's very, very good protection against that. Maybe 6 months down the road, if you're exposed, you'll get a cold, but you're not going to be hospitalized.
That's the breakthrough infection, that if you have symptoms,
Exactly.
but not necessarily get sick enough to be hospitalized.
Most people don't get anything. Yeah. Go on.
Fair enough, yeah. Which is, it gets confusing now when people say infection could be asymptomatic, you don't even know it, but they call it infection just because it tests positive. But
yeah, it's good. I think that's confusing too. So I think that's
yes.
I always say the thing that I care about the most is severe disease, right? If people get a cold, I don't want anybody to get a cold, but like you can't avoid that, right? That's what was there pre-pandemic. But being hospitalized with the respiratory virus, we all want to avoid that, and the vaccines are such a good tool to help us with that.
I mean, if the vaccine can convert a potentially deadly virus to a cold virus, they would have done 90% of their job, basically, right? I have a question. Actually, this has come up with questions I get sometimes at work from our own staff. Quote, I have read articles and know people whose menstrual cycles have changed due to receiving vaccine, reportedly. This is worrisome for people dealing with fertility issues to begin with. What is the data to support fertility? What is the data to support fertility? Did they study this in initial trials?
I'm not sure if they studied it in initial trials, but is something that people are bringing up. It's fairly uncommon. So we're talking about under 1% of women who have spotting or maybe a missed menstrual cycle or some heavier cycle after they had the vaccine. What we struggle is with the fact that there's a lot of things in life that can affect your menstrual cycles, and there's not a good explanation for why a vaccine would affect it, because it doesn't affect your hormones. It doesn't really seem to be any link between the two. They are still researching it. It does not seem to affect fertility. So if you go on the association, the Fertility Association websites, they are not recommending women who are struggling with fertility not get the vaccine, and they're not recommending any delay in fertility treatments after being vaccinated. That being said, anecdotally, because some patients have told me in certain fertility clinics, they are being told that they will not treat them for 1 to 2 months after having a COVID vaccine. And I think one of the problems there is fertility clinics want to have positive outcomes and want to have everything optimized. So they really have been telling patients this, but if you go on the websites for the associations, for the fertility clinics, they are not recommending this. So like, I would say there's no effect so far. It's certainly something that's being followed, but no evidence so far.
And if anyone is going through these treatments, I guess best to just speak with their own OB and about it sort of one-on-one.
Yeah.
Yeah. I have a question for someone eligible for the 3rd dose of a vaccine. Are there any safety concerns or benefits of getting all 3 doses during pregnancy? I didn't think that was still being recommended.
Yeah, that can't. You mean the 2nd dose? Oh, I guess I guess technically could if you got them at the beginning, because the 3rd dose is for the 6 months after the 2nd. But in Canada, we're not recommending that. So in the US, I'll be honest with you that I don't think most people need boosters. There's not really good evidence for needing us in most situations, except for LTC, long-term care, elderly individuals, and maybe profound immune suppression. So these are people that have blood cancers, transplant, that type of thing. For the rest of us, I assure you that our immunity after 2 doses is well maintained. Some data just actually came out from a thing called ISIS in Toronto, showing that at 6 months and beyond, your protection against severe disease is still very well maintained in pretty much all populations. So if you're pregnant, I don't think a 3rd dose is.
Yeah, I haven't. Yeah, I know there's some. Now looking at the US, for example, where they're recommending healthcare workers as being a higher risk category after 6 months because of the waning of the antibodies, not necessarily the memory B cells, T cells that protect you really from severe disease, but the waning of antibody, which increases the chance of that getting a cold, basically the breakthrough infections. So I could potentially, if somebody from here working across the border and they're being offered the 3rd dose, and they're already received 2 doses and they're pregnant, they might that small select group might actually be facing that possibility that
I feel
I can't
like the
comment.
Americans got it sooner than us too. So maybe more people are coming up on that 6-month mark. If you do go on the website for the American Association, like ACOG, they are recommending pregnant women, if they are eligible for a 3rd dose, get it. But our organization here in Canada hasn't recommended that. So I haven't encountered yet. Basically, it hasn't come up yet.
Yeah, no, thank you. I mean, it's not beyond, I mean, just like with influenza, we get it every year. So, I mean, it's not going to be out of the ordinary if one day down the road in next year, we're, advised to get a booster shot. So, I mean, it's part of vaccination. I mean, if you look at even current vaccines in adults, like hepatitis B, for example, we do it at 0, 1, and 6 months. So there's 3 shots, for example, right? In kids, there's 2, 4, 6, 18 for tetanus, diphtheria, things like this. So it's not uncommon, but so far as Dr. Chakrabarty said, there's strong evidence that even after 6 months, there's more than 90% protection against severe disease in immunocompetent people who don't have a suppressed immune system. More questions, if you don't mind. How do you respond in regards to the vaccine's spike protein traveling to the ovaries, and how could this further impact a woman already going through fertility struggles?
Well, the spike protein doesn't travel. Dr. Chakrabarty would explain it better than me, but it's not floating around really in your bloodstream. It's kind of expressed on the surface of your cells, and it's kind of helping your body recognize it, and is only expressed on it's only for the immune system to recognize. So your ovaries aren't affected. And the thing to keep in mind about ovaries is they're not really the most active cells in your body. For the most part, they're turned off, except for when they ovulate once a month. So really, they're not affected by a lot. So there's been no evidence that it infects the ovaries or affects the ovaries at all, affects your fertility or how many eggs you have left. So I would not be concerned about that.
Thank you.
Agree.
Does the vaccine make it worse to get pregnant with those who already have had issues in the past to getting pregnant?
No.
Yeah, I'm not aware of.
I would say sometimes people who struggle to get pregnant and have other health issues too may be at higher risk of severe disease if they get COVID, right? So if you're older, if you have any heart disease, you're immunosuppressed, you're overweight, you're a diabetic, those things, can lead to fertility issues. They also can lead to more severe disease with COVID. So I would strongly encourage them to get vaccinated.
Some of the questions I hear, for example, is, well, how do we know what the long-term side effects of this vaccine is? I personally can't predict 10, 20 years of anyone without vaccine or with vaccine, regardless of what's going to happen to any of us. But nevertheless, my feeling, and I'd love to hear your opinion, is that most of the side effects or potential complications, albeit rare, occur early on in the vaccination process. It's because of the activation of the immune system, whether it's the clotting that we get from activation of the clotting cascade, or what we hear about myocarditis, inflammation of the heart, is because our own immune system thinks that we're infected. That's what the vaccines do, and it revs up. Usually it's in the first month or two that we have these things, not necessarily 10 years away when there's no vaccine in our system. As Dr. Allen said, the vaccine is in our system for a couple of days, and RNA is very unstable and goes away. Isn't that is that what's your feeling about this question that keeps coming back? I don't get a specific concern about what happens in 10, 20 years down the road. It's just like, how do you know? But nobody really tells me exactly what the exact concern that they have.
Yeah, I think it is certainly the fear of the unknown. I think that when you're looking at the situation, is that you're right. I can't answer that question. But actually, Dr. Haddad and I were talking about this earlier today. Let's look at what's biologically plausible. Okay, could something happen 10 years down the road? But if you think about something that you're injecting into your body that's there for, literally hours, if not a bit longer, and then it's gone, it's not like a repeated exposure, like, for example, asbestos, right? It's also something that's having a very localized effect on your body. Can it theoretically cause something? I'm humble. I'm not going to say never, but it's just that it just seems very biologically implausible for something like that to happen. And I also agree, Dr. Haddad mentioned that most side effects that happen, things that, like myocarditis is important, the clotting, VIT from the DNA vaccines, the adenovirus vaccines with DNA, these things happen. They tend to happen in trials within the first 3 months. So I think that's what we look at. And now let's look at also what's happening on the ground. There's a theoretical risk that something could happen to you 10 years from now, versus we were in the second and third wave of COVID, and people were, getting intubated in the ICU on a ventilator. So I think that we have to look at what's happening on the ground and be pragmatic about it.
Yeah. I agree, like 2 points. When you're first born, your body's exposed to so many different proteins and antigens and viruses and things, and you continue to be exposed to new things your whole life. The second is, we know people who get COVID virus infections can suffer for it for months, and already we're seeing people with long COVID symptomatic, over a year after their infection. So there's long-term effects we know of getting the disease, where we haven't seen, at least so far, any long-term effects of getting the vaccine.
I mean, my personal experience, having gone through all different waves as an ICU specialist anyways, I mean, of course, I see the tip of the iceberg, not everybody, right? I see the sickest ones, that portion. Our ICUs were full basically with severe COVID disease, basically 100%, not a single one from vaccine related complications.
Yeah.
So men, women, young or old. Since I have you with me, it's not necessarily a fertility or pregnancy related question, but it does affect young families who are in the process of, conceiving and having kids and things like this. Is as we get into the younger ages, 12 to 18 and 5 to 11, and then we see that slight signal increase of myocarditis that we mentioned, inflammation of the heart, all being mostly mild and self-limiting, but nevertheless, it's there. It seems to be mostly after the second dose. That's, I guess, you're revving up the immune system further. It seems to be in younger boys, and that seems to be a more of the concern. Is that your understanding too, Dr. Chakrabarty? Or?
Yeah, definitely. And it's interesting. There's no why it's happening in young boys. Is it a hormonal thing? Is it something structural? We don't know, but it's certainly something. While a small risk, it's there. I mean, Mike, you're way better with the numbers than I am, but it's like 1 in 6,000 to I've seen also 1 in 14,000 in that range. But the thing that I think to remember is that when we look at why we vaccinate people, it has to be a risk benefit analysis, and something that's a small risk. Okay, that's small, but if you now also have a very small risk of severe disease or complications, then all of a sudden that small risk becomes something important, and that's, I think, what we should be looking at in the young age group, the 5 to 11.
5 to 11, yes. Going back to the OB population and some of the young staff I see or families. Some of them tell me, what, I'm doing my best, I'm staying safe, avoiding this and I'm avoiding that. Like, I know it's difficult in our field of work in healthcare, say nursing staff or physiotherapy, etc. They are actually patient facing. So it's hard to eliminate the risk completely, despite the fact that we have fairly effective PPE protections. But even if someone who doesn't work in a high risk environment and they're not necessarily even working and they could be at home, I asked them, do you have any other kids at home? Yes. Do they go to daycare? Yes. Like, so you have a bit of a back door. Like, you can't control exposure if you have kids mingling in school or daycare and they come back home. Are they seeing the grandparents? Oh, yes. Are they vaccinated? So it's not as simple as, as mom, keeping myself safe, but still there's potentially the back door for infections to get into the household. So that's the transmission part of it.
Yeah, I mean, every OB/GYN here in Sarnia and the midwives as well have all taken care of pregnant women with COVID in our community. So we've all taken care of them. The majority are not healthcare workers. They're just people with normal jobs, low risk on paper, except for, of course, young children, daycares and schools. And the majority have no idea where they got it from.
Yeah.
And they've been safe. They've been washing their hands. They've been wearing masks, and either their child comes home with the sniffles, and then gets COVID, and mom gets COVID, or they really don't have any idea where they got it. And so that's the scary part, because how can you protect yourself if you don't know where you got it in the first place?
Yes. I don't have any more questions. So just basically to summarize, it seems based on at least 10 months of vaccination now worldwide with, correct me if I'm wrong, more than 4 or 5 billion people now have received the vaccine, almost equal 50-50 men and women. About 1.5 billion are fully vaccinated who received the 2 doses. A variety of vaccines, the RNAs and the adenovirus, the AstraZeneca, etc. But mostly North America, it's the RNA viruses. We haven't seen a real signal increase to show that the vaccines are harmful to pregnancy or the unborn child. Fair enough?
We've seen that it reduces the risk of hospital admission by 80%.
Right.
Yeah.
But we do know from the effectiveness part of the equation is that it definitely protects pregnant women, just like it does protect everybody else who is 70 or 50 or 40 years old, regardless. And the risk calculus obviously shifts depending on the prevalence of COVID in the community. Obviously, as the prevalence or the cases go up, the chance of exposure goes up. But it's kind of hard to predict exactly what's going to happen over the next few months as winter comes into play and we all move indoors. We've seen some bad things happening in out west, in Saskatchewan, Alberta, etc., for example, right? Hopefully it won't be the case here. but it's hard to predict. And again, I mean, it's a good thing that there's our lives are slowly coming back to not necessarily full normal, but at least there's more reopening, more mingling, more socialization. The grandparents are seeing the grandkids again, and it's a good thing. It's healthy. But as we see this more and more, the risk of being exposed goes up as well. So the more vigilant and the more vigilance that we practice, the better, including vaccination, right? That's one of the essential things that we should strive towards. Well, I don't see any more questions, any more comments before we close. In closing, Dr. Allen first, I guess.
I know, I think you did an excellent job. I guess everything's a choice. So choosing to get vaccinated is a choice just as much as choosing to not get vaccinated. And every choice has consequences. So as long as you're well informed, you make the choice that you think is right for you and your family. But hopefully if there's any misinformation or any misconceptions, we've kind of addressed them tonight.
Dr. Chakrabarty.
Yeah, I think that one thing is that despite what you're maybe hearing on the news, what you might be seeing on social media, I think that most of us realize that if somebody has questions about the vaccine, you're not going to be branded an anti-vaxxer and not people won't talk to you. I think it's important. If you have questions, I get it. There's certain people that'll never take it. I'm fine with that. But there's most people are not like that, having done this for 10 years before COVID even, is that people just have questions. Talk to a healthcare provider you talk to, you trust. And oftentimes just that with the reassurance can kind of help you make the decision. But I do think that I want everybody to get vaccinated, but I want it to be by choice and you feel good about, well, you don't always feel good about it, but you will feel good about it afterward. But the point is that you should be able to, if you have your questions, it should be able to be answered respectfully, and you get all your fears out in the open and have them addressed.
Yes, I mean, we are doing well in Ontario relatively. I would say we're at 87% who've received at least one dose, 81% fully vaccinated among the 12 plus. That's really amazing. And hopefully, I'm keeping my fingers crossed. I hope we can keep our caseloads on the lower end, despite the more contagious variant, but we'll see. Hopefully it will be the case. Thank you so much for joining us tonight, both our public in the county and anywhere else who's been watching us, and also our guests, Dr. Chakrabarty and Dr. Allen, and wish you all the best, and thank you so much.